Dr. Perrett, let's talk about implants. You have talked in another video about the Xerox machine, which basically makes a crown within basically 20 minutes. And that's a wonderful thing, and the patient can watch it, and he doesn't have to take one of those uncomfortable impressions where he bites on a bunch of gum and glue and whatever.
Right.
So at the same token, one hears these days advertised instant, 1 day, 2 hour kind of implants. You walk in, they put a metal rod up you, and they put the crown on it all in 1 day. Why would one go for an implant where you put that metal stick up and then you wait a few months before you put the physical crown on it? Why would one go through this hassle if it can be done in 1 day, even a half a day? Tell us about the applications.
You want my opinion on this? Very good.
Yeah.
So, they're making improvements in implants all the time. It's night and day from whence we first started, and they just get simpler and far more effective. In my practice, I simply just take the point of view that you're using an implant. An implant actually is an artificial root. It integrates in the bone. It actually becomes part of the jawbone. And I like to give the implants plenty of time to integrate into that jawbone so that the chances of failure are a lot less. I usually do not, and actually I can't remember any circumstances where myself, and I do place some implants, or my oral surgeon will go and load them, meaning do the final product right away. The chances for failure can just increase. So on lower teeth that are in good jawbone, we like to give it 3 months. On upper teeth, a lot of times even up to 6 months, so that those implants really have a good, firm structure in there. Now, usually if let's say it's in an area on a back tooth, if it's a back first molar that's missing, chances are that first molar's been missing for years.
Right.
So what's 3 extra months? The patient's not going to show it off and say, look, I've got a space here, because they probably haven't done it over the years that they've had the space in there. They're not going to miss it because they've missed it for the last X amount of years. So what's the big deal on waiting 3 months on posterior teeth before you load them? On anterior teeth, absolutely. I can see a reason for someone wanting to get something there right away. In that case, you make a small artificial, what's called a flipper partial, so that the teeth have, you can put the teeth back. You can put the fake appearance of some teeth in there without harming the implant while it's healing over. And that's what works the best in my practice. I like to give them plenty of time for nature to take its course and for those implants to integrate, solidify into the bone. That way, when we do the final product in there, we don't have to worry about putting undue forces on there and, just having them loosen or fail.
So basically, you kind of like want to build a foundation. You want to kind of like let it settle, let it set, let it dry out, and then put up the walls, because at that point, and it wouldn't do much good, or at least it would be, rather inconvenient for a patient to have to come back 4, 5, 6, 7 months later to redo it all simply because it wasn't done right the first time. Okay.
Exactly.
Okay. So what is this 1 day implant all about? Just kind of like, yes, it can be done, and with a little bit of luck, you make it through. Is that kind of the idea about it, or what's the idea about it?
Honestly, since I've never done them, Helmut, I don't have an experienced track record to talk about them, but basically you put the implant in, and then the person builds the crown right on top of the implant. Or if it's done with if it's actually done with in conjunction with the lab, the lab can actually have the final product made so that when the implant is put in on what's called a guided surgery, meaning they know exactly where the implant is going to be placed in the jawbone, they know how the crown's already going to fit, and the crown is put into place. I think a lot of practitioners have some great success with that, and I'm certainly not knocking what they do. There's just a lot more room for error, and you're asking for a lot a lot of additional steps and accuracy in there. And once again, if there's a load or that implant doesn't totally integrate into the bone, well, then that's sort of a setup for failure in there. So that's what the 1 days are all about, and that's kind of
I got it.
Yeah, you got the gist of it there.
You at this moment stay away from it. Just that small little risk that it then might fail. You just say, look, let's just do it right the first time. Got it.
Exactly.
Thanks a lot.